Welcome back to another video. If you are new today, my name is Indy and I am a family nurse practitioner. In today's video, I want to talk to you guys about 5 common mistakes you should avoid as a new nurse or even a seasoned nurse. You should always avoid these mistakes. As we know that in nursing or in medical field in general, there is that pressure to be perfect, to do things the right way, to be alert, to be very smart all the time. There are things that you do not have control over, and there are mistakes that you can make if you're put under pressure. So if you're interested, then keep watching. Make sure you watch to the end. Ìwọ ni ọ̀rọ̀ tí ń gbé nínú ọmọ ènìyàn fọ́hùn. Ìwọ ni àdúró tì ní lọ́jọ́ ewúle kòkó. Ìbà A little bit about my background, just for the people that do not know. I've been in the medical field probably over 20 years. 10 of those has been as a nurse, and 5 of those currently as a nurse practitioner. In the 10 years that I've been in nursing, I've worked as a bedside nurse, and if you've not listened to my story, I will implore you to click here and after this video and watch it. I've worked as a wound nurse, I've worked as an infection control nurse, quality assurance nurse, and nurse educator. So when I worked as a nurse educator, it was kind of combined together, working as a nurse educator and infection control nurse. In another position, it was a nurse educator and a quality assurance nurse. So this is why I'm bringing you these stories, because I have had first-hand experience as a bedside nurse and also a nurse on the other side that was actually educating and having to deal with these issues in nursing. Number one mistake that you should avoid as a new nurse, which I think you know, is medication error. Medication error is one of the most common mistakes that people make in nursing. Whether you're a brand new nurse or a veteran nurse that has been working for a long time, this is a common mistake that people make. The common way that people make these mistakes is usually by giving the wrong medication to the wrong patient, giving out the wrong prescription, or giving medication at the wrong time, or giving the wrong dosage, or giving through the wrong site. And there are ways that you can avoid this. You always make sure you want to use your identifiers, especially make sure that you have the right patient and the date of birth. Always check the patient. Most nursing homes or hospitals, patients have wristband, because we all know that there are some patients that do have Alzheimer's, okay, or dementia, and they don't know their date of birth, or if you go in there and call them any name, they'll answer to it. So always make sure that you back it up with checking their wristband and making sure that you have the right date of birth, okay? Even as a provider, you can make this mistake, okay? I have been in a situation where my assistant would put the patient in a room and give me the wrong room number, and I'm going in thinking I'm talking to this person, when in actuality that person is the other room. And I've also made the mistake of walking into the wrong room where the wrong patient is. So what has saved me is always when I go in, I say, "Hi, Mrs. So and so," the first and last name, and the patient will say, "Hey, that's not me." Or even for someone that used to work a lot with Hispanic patients that don't speak English, sometimes they call them a name, they'll answer to it. So I always say, "Oh, I see that you're here because of so and so." So I make sure I mention the chief complaints, and most times they'll say, "Oh, no, that's not why I'm here." And then you look and say, "Oh, the wrong person." So you're not giving out any personal information. You're just making sure that you have the right patient. So I would say always make sure you look at the name, look at the date of birth, make sure that you check the medication that you're giving, making sure that you read the directions and you're giving the right dosage and the right route, and make sure that you're giving the right time, because there are people that will give medication, the medication is 8 a.m. and 12 p.m. and they will bundle it and give it at 10 a.m. That's wrong. I always say that you have to be compassionate to be a nurse. So if you don't have the patients and you cannot do your job well, maybe it's not the right place for you, okay? Number 2 is infection, okay? There is something called nosocomial infection. I'm sure most new nurses or nurses know. It is also called health care acquired infection or hospital acquired infections. Nosocomial infections are infections that are acquired while at stay in the hospital. So, say for example, a patient comes into the hospital or nursing home and they develop an infection. Maybe they have C. diff. Within 2 days, 48 hours of the admission, that infection becomes the hospital acquired infection. Or maybe they go home and they have infection within 72 hours. If they had surgery at the hospital, maybe they came to the nursing home for rehab, and within 30 days they have infection on that side. That infection belongs to the hospital that did the surgery. Okay, so within 30 days of surgical procedure, it's a hospital acquired infection from the hospital. Now, why people always get upset or managers get upset is because the government doubled down on the fact that if there's a hospital acquired infection, they're not going to pay for it. So if there's an infection that acquired while in the hospital stay or nursing home stay, the government is not going to pay for the IV, the medication, the stay. It becomes the problem of the hospital or the nursing home. Apart from that, let's say someone have a C. diff and you go into that patient's room, take care of that patient, you don't wash your hands, you move to the next patient that has an IV access, and then you maybe give medication or do something with the IV, you can easily give that person what is called a sepsis. That means a bloodborne infection, and that person can die easily. About 99,000 patients die every single year in a US hospital because of healthcare acquired infection. So please, please, please be very careful. It's also not about quality metrics, it's also about a patient's life. You put them at risk for death if you're not being careful. So if you have to go into a patient's room that has infection, make sure you're using the right PPE. Don't make that mistake. Always make sure that you wash your hands in between patients or you use hand sanitizer. If you're doing wound, you don't need to use hand sanitizer. You have to actually wash your hands with soap and water. Number 3 is charting or documentation errors. We know that in nursing, if you did not document, it never happened. Whether you did all your work, you did everything, if you did not document it, that means it did not happen. So don't make that mistake. Make sure that you document thoroughly, you're documenting in the right patient's chart, and you're documenting about the right patient. Don't take A's information and document in B's information. Don't be pressured. That is one thing that new nurses face a lot is pressure. You want to be fast because that person is done or that person, no. Make sure that you take your time and you think and you do things the right way. Also, make sure that you're charting any discontinued medication, any discontinued treatment plan for the patient, and make sure that you document and you discontinue them appropriately. Number 4, do not call for help without having the right information ready at hand. You call the doctor without having the right information, or you call 911 without having the right details about the patient. Those people can be very, very rude. I tell you, those people can be very rude. Especially if they come in there and you don't have the right information about your patient. They want to hear what is happening to this patient, what caused this, the patient's history, quick. It's not every detail, but something that they need to know, quick, take this patient. But if they show up and you look dumb, like you don't know what you're saying, you don't know what you're talking about, it can be very embarrassing, and they'll just look at you like this nurse is dumb. So please make sure you have your information. Again, don't be pressured. There's an emergency. Okay, we get help. Fellow nurses, gather your information so that when the EMT arrive, you have the right information, the details to give to them. And please make sure you get help. Don't make the mistake of your patient falling inappropriately. Now, accidents happen, but make sure that if you weren't the cause of that accident, and when that accident happened, that you took care of it and you did things the right way. Especially if the patient wants to go to the bathroom, if they need something and you know that this person is not somebody that can be taken care of by one person, please make sure you get help. Don't try to do it by yourself, because if you do it by yourself and the patient falls, there's a mistake, the patient broke their hip, you don't want that. My next video series is going to be stories that I've seen happen, mistakes that I've seen people make that you should avoid. I'm going to be telling those stories in order to help you to avoid. Now, I'm talking about accident, talking about a patient falling. I'm going to tell you a story how the patient felt and the nursing assistant was fired because of that. It is not because the accident happened. It's the situation surrounding the accident. So always make sure that you get help. Always make sure that you use the right equipment. If you have to go into a patient's room that has infection, make sure you're using the right PPE. If you need to lift a patient, make sure you're using the right equipment to lift them so that if anything happens, at least you did it the right way. Your nurse educator, infection control nurse should be your best friend. I was a nurse educator. I was an infection control nurse, and I can tell you for sure that my nurses, the nurses that I worked with, relied on me. If they were overwhelmed, they had that confidence to come to me and tell me that they are overwhelmed and they need help. If they needed to start an IV, they will come to me. I was someone that was trustworthy, where they could come for help, where they could come to ask questions, where they could come to get educated. You're not going to be fired right away if you make a mistake. The company that I worked with, if you make a mistake, we would retrain you, we will re-educate you first, even if it means to pull you out of the floor and re-educate you, retrain you, and then put you back. We will do that. It's only when you keep making the same mistakes over and over again that you will be fired. So don't be afraid to say if you don't know something, especially as a new nurse. Don't be afraid to ask for help. The nurses are there. I know they say nurses eat their young, but there is always that one person that is there that will help you to navigate this rough or new territory for you. Until my next video, I love you with the love of God. See you. Ìwọ ni ọ̀rọ̀ tí ń gbé nínú ọmọ ènìyàn fọ́hùn. Ìwọ ni àdúró tì ní lọ́jọ́ ewu le koko. Ìbà o, ìbà o.